At Dunes LASIK Center, vision correction is safe, painless, and $500 off for a limited time.
Being able to see without having to reach for my glasses every morning has been a godsend.
I love to get up in the morning and to be able to see clearly. It's freedom.
It's super easy. You just have to come in 2 times and you can see.
I used to have to wear pretty thick glasses, and now no glasses at all. It's remarkable.
You only have one vision, so you want to go with the best, and that's Dunes LASIK.
Hello everyone, welcome to another one of Dunes Eye Consultants LASIK live events. I've got some notes here, so if you see me looking to the side here, that's what I'm looking at. But what you just saw there is our current end of the year promo. That's $500 off LASIK surgeries when they're scheduled before December 31st. We'll talk more about that later. But to get things started off, we'll get into introductions. Today, right below my camera, we have Wendy Green, patient coordinator at Dunes, and to my left is Dr. Steve Ferguson, owner and vision medical director at Dunes Eye Consultants and LASIK Center. And then last but not least, we have our patient sharing her LASIK story today, Stacy Swore. And I'm going to start things off, sending it off to Dr. Ferguson. If you want to get us kind of an introduction into and an overview of what LASIK treatment is.
Oh, I'm glad to. Hey, welcome everybody, and first of all, happy holiday season to everybody. Our weather is really cooperating right now, so enjoy it while it lasts. So what is LASIK? I think the vast majority of the public has a basic understanding of what LASIK is, but let's just talk about it in some detail. LASIK is a 2-laser procedure, which one laser makes a very gentle incision on the surface of the eye called the cornea. Think of the cornea as the windshield of the eye. And that can create a nice little incision where the flap is created. The flap is lifted up. Then another laser gently reshapes the eye to change curvature to correct vision. The flap is put down, and it's a self-sealing type of incision where there's no sutures, and typically within 4 to 5 hours that initial healing has taken place. So that's a real quick summary of LASIK.
Perfect. And who is LASIK for, and why is it the healthiest and most cost-effective option?
Well, first of all, anybody that's dependent on an optical device, whether it's contacts or glasses, is at least a considered candidate for LASIK. Obviously, there's more parameters to look at, but that's step one. Step two is think about the burden that we have when we put glasses or contact lenses on, and not having to deal with that. So essentially, from a healthiest standpoint, we kind of contrast contact lens use. Contact lenses are medical devices regulated by the FDA. They carry some small risk of serious eye complications. Fortunately, that's not often, but when they are serious, they're very serious. And so if you look at research and studies, the model of LASIK safety versus contact lenses is pretty dramatic. LASIK is a very, very safe procedure, particularly comparing it to the risk of contact lens use. So that's kind of a general way to look at it from a health standpoint.
And when it comes to quality of life, how does LASIK?
So, well, first of all, let's think of like the dentist. Let's pick on our dentist colleagues. What if you could go to the dentist, have a procedure that your teeth were cleaned perfectly, and everything is great, and you never have to brush your teeth on a daily basis, and you go into the future for decades? Essentially, with LASIK, we're eliminating the burden for you to either have to find glasses to put on or put a contact lens in your eye. So it frees up your life. And that's just a starting point of the benefits of having laser or LASIK.
Awesome. That sounds great. And I think we'll probably talk on that a little bit when we get to Stacy, your portion. But before we get into that, Wendy, could you detail some of the experience, the side that you handle there with the consultation and everything?
Sure. So when you come in for your free evaluation. We do an hour-long evaluation. We run you through some tests and stuff and talk to you about whether or not you're eligible and if there's something we can do for you and how it would go. And then you'll come in for your surgery. We'll go over all the paperwork. You're usually in the clinic maybe 2 hours or so from start to finish, and then off you go onto your day and go home, take a nice nap, come back the next day. Doctor takes a peek at you. It's pretty easy, and then you're on your way.
Perfect. And flex dollars, all of that stuff, financial. What all is there?
Many options. You can use your flex savings account, your health savings account. If you've got, obviously you can use a credit card or cash, multiple different options. And then most of all, we've got Care Credit. We're partnered with Care Credit on that, where they offer you 2 years of no interest. So 24 months, you get to pay that off no interest. So that's really helpful for a lot of people.
Awesome. That's perfect. And is there anything else on that side that maybe patients or people watching might want to know about that experience?
This is pretty easy. It's very seamless. You come through. We always make you comfortable. We're going to give you some medication on the day of surgery to help you be calm and relax, and then help you take that nap. So we've been doing this for a long time, and you're really in good hands when you come here.
Perfect. And LASIK consultations, they're still free, right? Is that
Yep, still free, 100%. Yep, you come in, we'll check it out and everything like that, no cost to you. Absolutely.
perfect? I think that covers most everything there. Dr. Ferguson, now do you want to maybe talk about the process of diagnosing LASIK and if it's the right treatment? Should people be concerned about, oh, maybe I'm not applicable? Is there an age limit to when to get LASIK?
Oh, great. All great questions. And I'll kind of just expand on what Wendy was discussing, that the consultation is a critical piece, because what we do is we come in and find out structurally if the eye is okay. We have to sort of map the cornea and make sure that there's no abnormalities. That's just a fundamentally important thing. We critically look at tears, quality of tears, as they impact surgical recovery and how well you do on a post-surgical basis. The number one side effect of LASIK, you can induce some dry eye. But the one thing that we've done over the last 20 years is really learned how to manage that pre-surgically. Such an important step. So those are things we look at. The third thing, which is maybe the most important, if you are physically a good candidate, what are your goals? What are your goals? And it's different for a 25-year-old than a 50-year-old. And really, a 25-year-old really wants to see, great at distance, does not really have to worry about any of the up close changes from birthdays that occur later in life. And it's a pretty straightforward discussion. But once we go into the world where we're now losing some of our near vision, it becomes a bit more of an understanding. Sometimes patients come in and say, I'd really like to get away from bifocals and just be able to use some over-the-counter readers. Okay, that's very straightforward. Or patients come in and say, can I reduce my dependency on glasses overall? And then we may have to do some blending of vision. And we do a lot of it very successfully, but we always demonstrate to the patient prior what that would look like, so we can do that. And it's such an important part of it. So the consultation does a couple of things. Physically allows us to make sure that the patient's a candidate. And number two, looking at what their expectations are and making sure we can match up to that expectation level, because it's elective surgery.
Yeah, and that whole thing of about the patient experience kind of makes a lot of sense because it's not a one size fits all kind of a
Correct.
situation, is it?
No, no. So the eyes are cameras, the brain's the computer. What's fun about this is how everybody has a different visual perception, a different visual personality. And so working with patients to achieve 20 happy is the ultimate goal. We don't use terms like 20/20 and 20/15, although if you measure patients, a large percentage of patients are at 20/15 visual acuities today, which is beyond the 20/20 level. It's about 20 happy. What is making your visual status happy for you in your world and how you function? And so that is, to me, the part of experience that you just can't teach. For 20 years or over 20 years, I've been in this world, and I never tire of working with an individual patient to find what their goals are and then trying to help them achieve that.
Perfect. That's awesome. And speaking of uh, individual patients, we have one of those,
Oh,
Stacy. do you want to maybe talk to us and give us an overview of your experience at Dunes LASIK Center and with Dr. Ferguson?
Absolutely. Just as they mentioned, I came in for the consultation, and what really impressed me was exactly what Dr. Ferguson just said, is they're all about making sure that my eyes were healthy. We scheduled my surgery, and I could see immediately afterwards. The surgery was quick. It didn't hurt. It actually takes me longer at times to fill up my car with gas than the actual surgery took. It was very quick and very simple.
I like that. That paints a good picture. That I've never heard that
Yes.
before. But other than that, what was your life like before and then after LASIK? Like, what was that comparison for you?
Yes, I've had glasses since I was in the sixth grade. And when I turned to the eighth grade, I got contact lenses. And my previous eye doctor kept sharing that I wasn't really a good candidate for LASIK. And so I sort of accepted the fact that I was going to be dealing with contact lenses forever. A friend of mine referred me to Dr. Ferguson, and he told me, Dr. Ferguson did, that I was in fact a good candidate for LASIK. And I'm so happy I made this connection. I drove 2 hours one way to see him, and now I make that drive every year for my annual exam. So it's a wonderful, amazing experience. Dr. Ferguson is the best.
That's awesome. I think I might already know the answer, but would you recommend LASIK, and why might you recommend LASIK?
Absolutely. My vision is great. And I know a lot of other folks who have had LASIK at other places, and they're always using eye drops. And that's a sign they have dry eyes. I don't have that at all. I don't ever have to use drops. And I feel that that's the importance of choosing Dr. Ferguson, because he learns about the foundation of your eye and vision. And I don't have any discomfort or issues at all. So I highly recommend it. It's completely changed my life.
That's amazing. I think we kind of covered everything already. That was quick. Before we get into the review, though, we do have a couple questions on Facebook right now in the chat, so let me answer those. Here's one. I think we covered it, but can you still get LASIK at 66 years old? Dr. Ferguson, maybe?
Well, that's a great question. And the answer is yes and no. It depends. It depends on the status of your overall eye health. And the first thing I would think about is cataract formation. Cataract formation is a cloudiness of the lens inside the eye. It's a progressive change that goes with birthdays and eventually affects us like looking at through fog. So we would really look at the patient critically and try to quantify, if they have cataract formation, how much it's bothering them, and then lay out, hey, the expectation here is we don't know at what point you might lose a little bit of that clarity. And I'll give you a quick example. This might answer the question. I had a professor who's 68 years old that had cataract formation, came to see me, really wanted LASIK. I said, hey, listen, you've got a little early cataract formation. He said, okay, what's that mean? I said, well, it potentially could progress where you're not going to be unhappy with your vision. And what I would be disappointed is if we did surgery and 6 months later, you called me up and said, I'm really cloudy. And I say, hey, you need to have cataract surgery. So I really want to make sure that you're aware that that is a risk. Now, the rest of the eye health was good. But it's certainly a question mark as to how long you would get what I call the return on investment. He summarized it this way. He said, okay, Dr. Ferguson, if I have LASIK and then 6 months to 12 months from now, I call you and tell you I'm really blurry, I made a bad decision. But if I get 5 years or beyond, I feel like I made a good decision. Well, he chose to roll the dice and do LASIK. And fortunately, he extended, his vision was really good into his 70s before he was ready to have cataract surgery. So that's a great example. We've also had patients, though, that have had their cataracts removed, that have some residual correction and are very dependent on glasses that we've been able to do LASIK on as well. So it would depend on the individual patient. We'd look at it and we might offer to them even some options to correct their vision that are not LASIK, like an implant surgery. So there's a lot to talk about when we have someone at that stage. Great question.
Uh, we had another question in here about what is the typical recovery time after surgery and how much should I plan to be off work?
Okay, great question. We're focusing primarily on one procedure called LASIK, where there's a flap and a laser correction. There's another procedure called PRK that is occasionally done if we felt like the patient that we wouldn't want to make a flap for certain reasons, and we would educate the patient on that. So let's focus on LASIK recovery. There's a couple of steps. Post surgery, 4 to 5 hours, you'll have a little bit of discomfort and best to take a nap. The initial area where the incision heals rapidly. The eye is the fastest healing organ in the body. So you're going to feel pretty good after about 5 hours post-surgically. And then the next step is overnight. The flap starts to secure really nice. Then it generally goes on, and it just becomes more secure. So the recovery is quick. Patients can return to normal activities day one, with the exception of being in pools or fresh water for a few weeks, and any extremely, heavy lifting beyond 35 pounds. So it's a fast recovery, and which is really what makes it so popular.
Awesome. We had one more question in here, and I'm going to try to read it through. It's very specific to a patient, I think. So here, I'm just going to get into it. They had type 1 diabetes for 17 years, and they had a pancreas transplant nearly 24 years ago, and have been on insulin and have been complication free since. And they have had laser sessions for retinopathy year pre-transplant, and they're nearsighted. Would they be eligible for LASIK first, or is this maybe something that would be handled more in the consultation? Is there anything that you would like to?
Yeah, so you have to think. Yeah, Mason, let's think about this. So number one, most of those treatments are in the back of the eye, where diabetes affects us. But diabetes can also affect us in just general wound healing. So the discussion would be with the patient. Number one, the cornea is avascular. There's no blood in the cornea. But you are going through and changing and making some incision through nerves. And so nerve regeneration is important. So that really, you have to really think about that with patients. We've certainly done type 1 patients many times over the years. But it's one of those where I would have a really good evaluation of the patient, look at their surface, look at if there's any type of subtle or abnormal tear qualities. And we might even just really talk to the patient about other aspects of their general health to make a good decision. We would approach it with more caution, but we certainly wouldn't automatically say no until we've gone through that consultative experience.
Yeah, perfect. Makes a lot of sense. We got our questions answered. We've gone over, I think, just about everything. Just to review, Dr. Ferguson, is there anything you'd like to add in regard to LASIK surgery?
Well, LASIK's a great part of our practice. And certainly it can potentially be life-changing for many people. As we become more and more nearsighted, we become very dependent on optical devices, and even patients that are farsighted as well. But so it's very much a life changer and a game changer, if you will, for many, many patients in terms of just functioning in day to day and not having to depend on putting glasses or contact lenses on. It's a very, very successful procedure. You cannot survive in the elective surgery world without having great success. And the key is all the work has to be done on a pre-surgical basis, evaluating patients, making sure they're good candidates, making sure they know their goals, making sure they know all the available options to help enhance and change their visual correction. And that really leads to patients being a lot happier and feeling like they're getting what they were trying to accomplish. If they're a great candidate, I'm almost like today's success rate and understanding with our technology, it's almost like, hey, wow, why wouldn't you do it? But the key is making sure you know exactly your status. And the other part that's been touched on here is how critical it is to pre-treat any subtle abnormalities to the tears. I tell patients when they come in for a screening, I look at them and say, if you're here for your general exam, we might say, we see some subtle changes to your tears. You're not symptomatic, not creating any problems. We might observe that, but not going into surgery. It's almost like having a slight abnormality to your blood system. we're going to manage that before we go put you into surgery. So it's the one modifiable factor that has been probably the most significant in the last decade that has really helped us. And it's supported by research. It's not just Dunes Eye. This is kind of standard across top centers in the world that perform LASIK. So.
Awesome, perfect. And to wrap up, the LASIK $500 off promo that we were talking about at the beginning, that goes on now through the end of the year is when you have to schedule it. But you can schedule the surgery right next year. The promo is just that you have to get it scheduled before the 31st of December.
I think our plan is to see if we can get patients in for their evaluation and screening. And then they have time. They can, they could look at January, February, March as dates, but we just want to give them that opportunity to get the gift of sight before the end of the year, and maybe save a few bucks and spend them on different Christmas presents or for themselves. So.
Awesome, that's great. And I think that covers everything. I want to thank everybody that joined, watched in, asked questions, and thank you, Dr. Ferguson, Wendy, Stacy, for coming on, joining, and having this opportunity to talk about LASIK. But yeah, that's all I have.
Great. Well, I'd like to thank Stacy. You said some really nice things. I'll send you more gift cards.
That's very nice of you. Thank you. I'm happy to help.
And thank you for spending time and sharing your experience. And thanks, Wendy, for being on, and one of our great teammates at Dunes Eye. And of course, thank you to Kaleidoscope Marketing, Mason. You guys do a great job with this. So we appreciate letting us share a little information to the public.
Awesome. And thank you all that was watching. And if you have any more questions, go to duneslasik.com for more information, or the link that is in the LASIK Live event. But that's going to end everything here. So bye, everyone. See you next time.
Bye. Thank you.